Well, hello, Allison. And how are you today?
Hello, hello. I am enjoying this weather. It's 80 degrees here in Humboldt County. Feels awesome. Get to wear a t-shirt and shorts. How about you, Sarah?
I am melting. Um, we are down visiting some family in Auburn, California. And it is, let's see here, it is 111 degrees today. It's just a cool 111. So I just got out of the pool and was dry in the 5 steps that it took to get inside the house.
Oh, good old Sacramento heat.
Oh,
Um,
man.
yeah, definitely necessary to have a pool.
Allison, I really, really, really want to thank you. Uh, guess whose episodes are up on YouTube? You asked for it, and we officially have episodes up on YouTube. So thank you, Allison, for making that happen. And thank you to everyone who has been listening. It means the world to us. It's so much fun. If you did watch, let us know what you think. Subscribe and give us some feedback. We want to know more about what you want to hear, what you want us to talk about, what you want to talk about. Let us interview you. Let's do that.
Yep, yep. Yeah, because this is for knowing what people want, knowing what people are interested in learning, because we're interested in all of this. But if listeners aren't, then that doesn't matter. So it's good to have those conversations and just get an idea of what people are really interested in learning about. Which reminds me, somebody asked on Instagram if we could do an episode about sex and pregnancy. I forgot about that. So we need to actually do one.
That is no problem. I just did that part of the course of our sex coaching course was the pregnancy and postpartum and sex. Oh, you guys, I mean, I could do some. That one we're definitely going to need a video because I could do some positioning.
Yeah.
Always fun. Always fun.
Yeah, we're gonna have to do like a whole series about sex and different
Yeah,
all stages of life.
that's right. That's right. But to today's episode, who doesn't want to talk about poop? It's all about poop, you guys.
Yeah, I think of that cute little kid's book that says everybody poops, right? And, it's good to talk about because bowel movements are huge. If you're not having a bowel movement almost every day, if not every other day, there's something going on. And it's important to talk about and get that bowels moving.
And the consistency and all of it. And that's what we're going to dive in today.
We're going to go over how our digestive process works, talk about the Bristol stool chart, and talk about what is constipation and how do the pelvic floor muscles work when we are having a bowel movement, and give you a couple little tricks that you can use to help improve your bowel movements.
So I think we already kind of touched on it, but how often should we be pooping? What's the guideline there?
Ideally, every day, if not every other day. If you're going more than 3 days without having a bowel movement, that is called constipation. And if you're having little bits of bowel movement, you're still constipated. If you're not having a full, complete bowel emptying, then that means you're constipated.
Yeah, so we go by the rule of threes. Technically, there's a range of normal, right? No one is like perfect. And everyone's systems are a little bit different. So they say 3 times a day, up to 3 days. So once every 3 days. So the rule of threes is kind of like the steadfast rule. However, depending on your diet and water intake and all of the things, ideally we're pooping every day.
There we go.
Yeah.
Yeah.
Yeah. Yeah, which kind of gets us a little bit more into the digestive process and how it works. Everything that goes in must come out in some form or another, right? So what happens is we ingest our food, and Allison, take it away if you want to dive in to any of it.
You got this.
Ingest our food, and throughout the transit process, we take out nutrients, we take out water, we take out what our body needs. And then anything that is left makes its way through your digestive process. So we have the small intestine, which is actually, I forget how long it is, but it's some like 20 feet long or something. All the gobbledygook in the middle. So after it goes into the stomach, it heads to that small intestine, which is the gobbledygook in the middle. And then it goes into the large intestine, which empties onto the right side of your body into the large intestine, like I said. And then it goes up the ascending colon over to the transverse and down the descending colon, and then moves its way out to the rectum and have your bum, right?
Yeah.
And so throughout the whole passage, we're creating nutrients and the different things that our body need.
And you touched on water, right? Water is huge. If we're not drinking a lot of water and we're dehydrated, that makes our bowels a whole lot harder to have. So water is big. So yep, like Sarah said, it gets absorbed in our body. And if we're not drinking enough, that can be an issue later on. And yes, Sarah, you are correct. I just looked it up and it's around 20, 22 feet for the small intestine. So that's a lot.
That's a lot of curves and twists and little movements to get through, pretty wild.
It is. It's impressive that we never think about it and our body just does it until there's a problem. But it's impressive how we have bowel movements with all that it goes through.
Yeah. And how it's all connected with the omentum. We don't really get into the anatomy of it because we'll nerd out for too long. But yeah, it's fascinating. It's just like our bodies are amazing. They're so amazing. So then when it comes out, what does it look like? Why does it look that way?
This is getting into the Bristol stool chart. So if you're not familiar with the Bristol stool chart, it's a chart that shows what the consistency of your bowels are. It's 7 types. Type 1 is when they're really separate hard lumps. So there's some fun things kind of thinking about, like it's raisinets or it's like little rabbit pellets, whatever.
Deer poop. It looks like deer poop. It's
There
identical. Yeah.
Type 2 is when it's more lumpy and sausage-like. And then type 3, same thing. It's a little sausage-like with cracks in it. I kind of like thinking of it as like a Snickers bar. Like you're never going to think about candy in the same way. Type 4 is more smooth and long. Ideally, we want to try and be in this type 4, type 3 range. Type 5 is more like soft blobs. Type 6 is more mushy with like ragged edges. And then type 7 is more like diarrhea, liquid. So we do want to be more in that type 3, type 4, ideally. Do you have anything to add to that?
Well, just why we might have the different kinds of stool. People have an entire range of different things. One, some people just absorb things differently for multiple different reasons. SIBO, right? There's all of these different conditions where people's bodies don't absorb things the way that they could, or allergies, right? So allergies is another one. Gluten allergy. My gonna love me talking about this, but one of my brother-in-law, gluten, right? I cannot tell you, he will clear a room in 5 seconds flat because of his flatulence. And that's just when gluten is present on board, right? So all of our body just manage things a little bit differently. And so what we want to really pay attention to is, why are these different things happening? So if we're at that type 7, where it's that really liquid diarrhea, it's inflammation in the body, and our bodies are really just trying to get rid of it, right? So this is a lot of times when people are sick. For some people, coffee does this to them. I'm going to say it a million times, but everyone's body is different. So finding out what are your triggers, how we kind of get to that ideal 3-4 Bristol stool chart consistency.
And dairy can be a big trigger too.
Dairy is a huge one for people. We always tease in the pelvic floor world, but It all starts in the bowels. I can't tell you how many times people are like, I don't understand why you're talking about bowels. And I'm like, oh, if we can get your bowels on board, it helps with your pro. If we can get your bowels on board, it helps with your tight pelvic floor, right? If we can get your bowels on board, it will help with your urinary incontinence, right? So all of these things are totally tied together. And again, it goes back to that anatomy and how much it's all kind of connected right there.
Mm. So many people, when we give people their handout of like questionnaires and before they come in back and see us, there's questions about urinary stuff. There's questions about bowel. There's questions about sex or intimate pleasure. And so many people are like, well, I'm just coming here for my bladder. And then as they read through it, they're like, oh, I actually have some bowel issues. I actually have some pain with intercourse. And it's all related. I mean, if we look at the anatomy, they're all connected there. It's great to understand how it really all works together. Yeah.
Yeah, it's super important. So, how many people have been traveling? And traveling is like it's all like it just sets you off, right? So you're either going to be, and most people get really constipated while traveling. However, I have quite a few patients who get really, really loose diarrhea. So why does that happen?
Oh, yeah. Lots of reasons for people who travel, especially like airplanes. If you're not somebody who is comfortable with traveling or we're just in a different environment, there's a lot of anxiety and stress that goes into that. And when we're stressed and anxious, our entire muscles, all of our muscles just tighten up and won't let go. There's a big mental component that goes into having bowel movements. And so that's big. One thing. Also, we tend to not drink as much, or our diet changes as we're traveling. We try a lot of different foods. I was recently in Chicago and I was just eating like all fried food, deep dish pizza and uh, lots of dairy products and things. And I was like, man, this is definitely affecting my digestive tract. Yeah. So those are
Yeah.
the two main things.
Well, I just think of if you are really stressed and you're running away from a lion, right? You're not going to be able to poop. So if your body is in that fight or flight response and your nervous system is just amped up, you're not going to be able to poop, right? It's a genetic way of trying to live. So really paying attention to, oh, that's right. How do I calm down that nervous system? How do I calm down my body so that I can actually have a nice, healthy stool?
Yeah, I'm gonna share my own story. I remember I went to Europe. I think I had one bowel movement in the 3 weeks that I was there, which is wild. And this was when I was in high school, and like you don't pay attention to that stuff. And looking back on it, I was like, holy crap, that was not okay.
Literal crap.
Yeah, little crap. Yeah, and I remember coming home and just like being on the toilet the time. So I was clearly really stressed over there. I was with some friends and not in the comfortable environment of my home, and just realizing that really does affect our body.
And even
Yeah.
going back to that with kids, you're
Hmm.
totally right, right? So setting those precedent as a child or talking with patients in adulthood about their bowel habits as a child gives you such an insight into their bowels and pelvic floor health in adulthood.
Hmm.
100%.
I've had some patients talk about their experience as a kid, and their parents were kind of neurotic about things and would like really stress them out, essentially like, you need to have a bowel movement before we go on this trip because otherwise we're not stopping for anything. And so then they wouldn't end up having a bowel movement because they were so stressed, and then it just kind of perpetuates into, this is somebody who is 60, 70 years old, and realizing, now they've got a lot of challenges with bowel movements, fissures, fistulas. It's a whole thing. So not to stress anybody out, but
Okay, so what can we do for constipation, right? How do we better, or diarrhea, right? How do we try to optimize our bowel function.
A lot of the things that we just touched on, right? Diet, recognizing what our triggers are, recognizing your water intake, things like that. And that's something to really hard, but good to pay attention to. The other thing, yeah, stress, right? What is your stress? When you go to the bathroom, can you take some time to pause and really fully relax? Because if you're rushing, if your pelvic floor muscles aren't fully relaxed, you're not going to be emptying all the way.
I just got to say it. I mean, hello, squatty potty,
Mm-hmm.
right? So, squatty potty is a Shark Tank invention. Oh, yeah. Yeah.
For those of you watching YouTube, I've got a squatty potty that you can see. And this one folds so you can travel with it. And it's super light. And if you don't want people to know you've got it, you just tuck it by the toilet and people won't know.
Amazing. So, I've shared with you all that I have a bunch of kids. So, I just use my kid's stool because there's always a stool around.
Mm.
But I have a fancy bamboo one at the office. And I have, like there's so many different kinds. These people on Shark Tank, they really crushed it with the squatty potty thing because Allison and I both live in Humboldt and are outside adventurers. I tease, but like, how much easier is it to go and squat in the woods and have a bowel movement? I know you're not supposed to do that and all of this stuff, but it happens every once in a while. How much easier does it come out? What changes in the consistency? Is there straining? Do you fully empty? Like, is it, I call it a clean out, right? Instead of having to wipe a bunch of times. It really changes for a lot of people. And the truth is that it just, and I don't have my pelvis with me, but well, I mean, I do, but you know what I'm saying. Yeah, it just changes the angle of that rectum so that there's more of a straight shot.
Mm-hmm. Yeah. And you can poop out in the woods. You just have to dig a deeper hole.
Yeah. I just, I'm not even going to go into my latest backpacking story with a bunch of kids because it was just too funny. But the whole idea, right, is just trying to make it into that squat position so that you can fully relax. So one of the muscles, puborectalis, attaches to the front, your pubic symphysis, and then it's like a sling and wraps all the way around your bowel and back into the other side of your pubic symphysis. So it really affects the angle of your rectum. So if that muscle is really tight, and what we see a lot of times with that hypertonic pelvic floor, those really tight pelvic floor muscles, a lot of people will have constipation because they're not able to let go and open up that puborectalis. And so then they're not able to have complete bowel movement. And I think one of the biggest things, and again, breath, but breathing while you're on the toilet. So many people bear down and hold their breath. It's called the Valsalva maneuver. And if you're holding your breath to try and push something out, that's where we get our hemorrhoid. That's where we get bowel prolapse. That's where we get all of these different things that are harmful to our body and can cause a lot of pain, especially with bowel function. So everyone's like, but then I can't get it out. Like, what are you talking about? I can't, it won't even go. So I challenge you. Here's the challenge. Get in that good squatty potty position, bend it, leaning over your knees, take some nice, deep diaphragmatic belly breaths, and then bear down while you're exhaling.
So not holding your breath, bearing down, exhaling out.
You still get force. You're not maybe going to get quite as much force, but you're still getting force and you're not dissipating that pressure inappropriately.
Another one is just opening your mouth and doing a hum or a moo to poo. If you've seen that gal on YouTube,
Yeah.
the Australian physical therapist. Yeah, moo to poo, which sounds funny, but it reminds me like, oh yeah, just a little bit of humming or sound can help. So I understand that it might be embarrassing to do that, but if you're at home with your partner and family, by all means, they should be fine with it, and they should probably do it too.
They should definitely do it. But then there are different things that can help a lot of people. And again, talk to your doctor about all of this. But Miralax is great. There's different teas and things like that. So I have some patients who are like, oh gosh, I can't travel without my certain kind of smooth move tea, or suppositories as well. A lot of people use suppositories just to make sure that their bowels are functioning and good so that they don't get blocked up. These are things we don't want to necessarily rely on, but in certain circumstances, they can be super, super helpful. And there's some people who use them all the time for totally different conditions and different things. So it just goes back to how important it is to have regular bowel movement. Not necessarily no matter how you get there, but different things to do in order to make that happen.
And then one other thing we talked about too in multiple episodes is the whole I love you massage. We've talked about that at length in a couple of the episodes, just making that little U shape or doing a couple strokes on the left side down just to move that stool out, and then going across right to left. And we do have a video of this that we'll put in the link so you can see it too. And ideally, it's great to do it in the morning before you get out of bed, so you're getting that stimulation, parasympathetic nervous system, so that starts that peristalsis, moving the stool. But really, whenever you can do it is still helpful. It's not going to happen automatically, but it will start to just move the process along and stimulate some of that parasympathetic response.
Yeah, so important just to get it moving. It does take about 24 to 72 hours for the food in to make it all the way through the digestive system. So that's why a lot of times people will have bowel movement in the morning, is because they've eaten at night. And so it just depends on what you're eating and what happens. And so much changes over the lifespan, right? Your digestive system slows down. One huge factor is the hormone factor. Has a huge effect on our bowel function. I can't tell you how many menopausal women will be like, I was never constipated until menopause. All these different things, it really just plays a role. So knowing that things can change and we might have to modify our diet, our water, all of those things to again help that bowel function.
One way to test how your digestive tract is actually moving to see how long it takes is the corn test. That's one test, right? I also saw somebody.
Have you done that?
I mean, not like purposefully, but
totally.
Yeah, but corn does not digest in our system, so you can see it in your stool. So that's a great way to test how long it took to get through.
And it's kind of, and I know this, again, this is gross. Look at your poop. Right. Oh, yeah. That happened. Okay, good talk. Even if it's just a quick once over. All right, that was Bristol stool chart number 2. Needs some more water. Good talk. But right, just having that visual feedback can be helpful.
So the next time you poop, think of us. It's so funny.
Yeah.
So enough about poop. We're going to move on to what is your favorite book that you are reading right now, Sarah?
Oh, there's so many good ones. So I do Audible. I don't know if anyone listens to books online. And then I have like my bedside reader that I read. And right now, my bedside reader for fun is the Robert Galbraith series. So Robert Galbraith is J.K. Rowling's pseudonym. I'm a Harry Potter fan. I'm just going to tell you straight up, love the Harry Poot. I just really enjoy her writing. So she wrote an adult series, and it's murder mystery. And it's just such a good page turner that I just love it. What about you, Allison? What book are you reading right now?
Well, I can't say it's like uber fun. It's good information. my bedside reader is Come As You Are by
Oh,
Emily Nagoski. And that is a great read and about coming as you are, sexuality and knowing what you feel comfortable with. And also like really big thing is communication between your partners or partner, whoever you are having intimacy with, and even not, it's about communication with all people that we have relationships with. So it's a really great read in that regard. And then the other book that I'm listening to on Audible is The Body Keeps Score. And
you're
uh,
diving really deep in
I,
that pelvic floor world.
yes, I am.
Those
It's a
some both
bit,
are big read.
yeah, The Body Keeps Score is definitely a really good one, but I have to listen to it in bite sizes because it touches on a lot of really serious things and recognizing how trauma, whether it's like the big T trauma or the little T trauma, right? We all experience trauma in some way, and just how our body responds to it is huge. So, that mind body connection and recognizing that aspect of it. So both pretty heavy books in different ways. So I probably need a little
We need to
lighter
lighten your
read.
reading list. I have a bunch of books in my library and my office, and those two books are the one that I loan out the most. I have like 4 copies of each of those books, and I'm always like, "Please, you might want to take a read," because both of them are just done very well and touch on such important things. The other one by Dr. Nagoski, it's Come Together,
Hmm.
and it's all about relationship. Have you read that one yet?
No, I've got that on my bedside too.
Okay,
I think I've actually started reading the first chapter, and so it's nice because she goes over a lot of the concepts that she did in Come As You Are. So repetition is great, and it brings a little different insight to it too.
and I think actually with both of those books, you touched on the communication aspect of it, of with the world, but communicating with yourself, I think is so huge in both of those books. Because if you're not able to be authentic and true to yourself and communicate with yourself, it's very hard to be out in the world and communicating with the outside world in a receptive, authentic way.
Highly recommend those books. So we'll also put
And my
those books
fun
in the
read.
show note and your fun read. Thank you all for listening, and thank you to everyone who has followed us on the podcast, on Instagram, and subscribed to our YouTube channel. If you haven't already, please do so. Links will be in the show notes. Thank you again for listening, and remember to keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapist, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.